So let's talk about the bone marrow biopsy. The goal of this is to analyze what exactly is going on in the factory or your bone marrow. This is a minimally invasive procedure done at the bedside, and the goal is to remove a piece of your bone marrow and a little bit of that bone marrow blood by inserting this hollow needle into the hip bone. You are not under general anesthesia. You may have some pain medication or anti-anxiety medication beforehand. We are not close to your spinal canal. We are not close to major blood vessels or major nerves. We're really just looking to get on the edge of that hip bone, taking really only about 0.5 centimeters amount of material to then send to our pathologist to analyze and get the answer of what specific type of leukemia and different markers do you have so we can individualize your treatment. Now, what do we look at inside this bone marrow biopsy and aspiration? Aspiration is just a term kind of for getting the blood fluid of the bone marrow. We look at both the tissue biopsy and the aspiration material. I like to think of kind of 4 big buckets for what we look at in the bone marrow. First, the pathologist is going to look at the cell counts, or how many leukemia cells are in the bone marrow. And that can range from a small percentage to a high percentage. And then they'll also look under the microscope at the appearance of these abnormal white blood cells. So I kind of think of it as the photograph of the different leukemia cells in your body. Then we'll look at something called flow cytometry. I think of that as kind of the fingerprints of your specific leukemia cell. So by looking at different markers, they're able to tell, okay, does this fall within that myeloid or AML category, or within the lymphoid or ALL category, as well as other more sub-classified types of leukemia. They'll also look at the chromosomes within each of your leukemia blood cells. That's kind of the manual for how your body creates the different blood cells. So they'll do special testing to see what the manual is looking like and what abnormalities may be present. And then they'll also look at molecular testing, which is how we look at different genetic changes that are occurring specifically within the leukemia cells that are abnormal. Not necessarily things that you've inherited, but what specifically is abnormal in the leukemia cells, leading to this overproduction and abnormalities within the leukemia cells themselves. Now, why do we do this? That's the most important part. We want to make sure that we're risk stratifying patients with leukemia based on this information, especially from the bone marrow. Unlike other traditional cancers like breast cancer or lung cancer that can be staged from stage 1 to stage 4, leukemia doesn't really have that kind of staging, but we think of it more as risk stratification. Then these different types of variables will also help determine what's the specific individualized cancer treatment approach for you and your individual type of leukemia. And then it's also helpful for your oncologist to have a baseline measurement. What was the percentage of leukemia cells in the bone marrow before we started treatment? What were the specific genetic mutations that were present before we started treatment? So that after treatment, we can compare another bone marrow biopsy to what you first started with.